Hello, and welcome. If you or someone you love is having trouble hearing lately, you're not alone. Hearing loss is one of the most common challenges we face as we grow older. In fact, about 1 in 3 people aged 65 to 74 experiences hearing loss, and that number rises to nearly half of people over 75. But here's the good news. There are ways to manage, cope with, and even improve your hearing and quality of life, starting today. So grab a cup of tea, get comfortable, and let's talk honestly, clearly, and calmly about what causes hearing loss, how it affects us, and what we can do about it. What is hearing loss? Let's begin with the basics. Hearing loss means that your ears aren't picking up sound as well as they used to. This might show up as trouble understanding speech, especially in noisy places, or needing to turn the TV up louder than others like. Sometimes voices start to sound muffled, or it's harder to hear high-pitched sounds, like a grandchild's voice or the ding of the microwave. This can be frustrating and a little scary. But don't worry, understanding the causes is the first step to finding a solution. What causes hearing loss? Hearing loss can have many causes. Let's take a look at some of the most common ones. Aging presbycusis. As we get older, the tiny hair cells inside our inner ear, these help us detect sound, begin to break down, and once they're damaged, they don't grow back. Loud noise. Over time, long-term exposure to things like traffic, concerts, power tools, or even vacuum cleaners can slowly damage your hearing. Infections and illnesses. Infections like otitis media, that's a middle ear infection. High blood pressure or diabetes can also play a role. Medications. Some drugs, like certain antibiotics, chemotherapy meds, or even large amounts of aspirin, can affect your hearing. Family history and genetics. If hearing loss runs in your family, you may be more likely to experience it. Earwax buildup. Yes, sometimes it's as simple as too much wax blocking the sound. Luckily, that's easy to treat. At birth, hearing problems can also start early in life, from things like prematurity, lack of oxygen at birth, or infections during pregnancy. How do you know you have hearing loss? So how can you tell if you, or someone you care about, might be losing their hearing? Here are a few common signs. You often ask people to repeat themselves. You find it hard to follow conversations, especially in groups. You turn up the TV so loud. Others complain. People seem to mumble, or you have trouble understanding them. You have ringing in your ears. That's called tinnitus. You struggle to hear children or higher-pitched voices. If any of these sound familiar, it's time to speak with your doctor or an audiologist, a hearing specialist. Why it matters. You might be thinking, it's just part of aging, right? Yes, but untreated hearing loss can affect more than just your ears. It can make conversations frustrating and lead to social isolation. It may even contribute to memory problems and a higher risk of dementia. It can cause anxiety, depression, and misunderstandings with loved ones. But don't worry, because just like wearing glasses helps with vision, hearing aids and other tools can help you stay connected, independent, and safe. Types of hearing loss. Now let's talk about the types of hearing loss. Age-related hearing loss, presbycusis, is gradual and affects both ears. It usually starts with trouble hearing high-pitched sounds. Sudden hearing loss can happen quickly, sometimes over a few days. If this happens, it's an emergency. See a doctor right away. Tinnitus, that ringing, buzzing, or hissing sound in the ears, can come with any type of hearing loss. It's not dangerous, but it can be annoying. Each type is different, and getting the right diagnosis is key to finding the right help. How can you cope? So what can we do about hearing loss? Here are some practical ways to cope and manage it. Use hearing aids. These little devices make sounds louder and clearer. They come in all shapes and sizes, and many are nearly invisible. Try assistive devices. There are amplifiers for your phone, vibrating alarms, and even TV speakers made just for people with hearing trouble. Use good communication techniques. Ask others to face you when they speak. Find a quiet spot for conversations. Don't be afraid to say, "Can you repeat that a little more clearly?" Make your home hearing friendly. Turn off background noise when you're talking with someone. Use brighter light so you can see lips and expressions better. Stay mentally and socially active. Join a club, talk with friends, and do things that keep your brain sharp. It's all connected. Preventing further hearing loss. Even if hearing loss has already started, you can still protect the hearing you have left. Here's how. Keep the volume down. When using headphones, make sure no one else can hear your music and never blast it. Wear ear protection. Use earplugs when mowing the lawn or at loud events. Get regular checkups. Have your hearing tested every couple of years, just like an eye exam. Eat a balanced diet. Lack of certain nutrients like manganese and tin may impact hearing health. Clean your ears carefully. Avoid using cotton swabs deep in the ear. Let your doctor help with wax if needed. Tips for family and caregivers. Now, if you're caring for someone with hearing loss, thank you. You play an important role. Here are a few gentle tips. Be patient. Don't say never mind or give up mid-sentence. Speak clearly, facing them, and use simple words. Don't shout, it distorts your voice. Instead, speak slowly and clearly. Include them in conversations, even in group settings. Encourage hearing. Aids or doctor visits, but do it with kindness. Avoid overhelping. Let them try first. Being overly supportive can sometimes hurt more than help. Final words and key takeaways. Let's review what we've learned today. Hearing loss is very common, especially as we age. It can affect relationships, safety, memory, and mood. But there's help, from hearing aids to simple lifestyle changes. Don't ignore the signs. Get tested and talk to your doctor. Stay engaged, stay active, and don't be afraid to ask for support. You don't have to live in silence or isolation. Whether you're experiencing hearing loss yourself or supporting someone who is, remember, you're not alone, and there are tools, treatments, and people who are ready to help. Thanks for spending some time with me today. If this video helped you, please consider sharing it with a friend or loved one. Let's help more people live full, connected lives, no matter their age or hearing ability. Take care of yourself, protect your hearing, and remember, you deserve to be heard.